founder and the CEO of the Pacific Specialist Healthcare, Mr. Pravesh Kumar, the chairman of the Sugarcane Growers Fund Board, Mr. Ahmed Bhamji. Thank you for coming over all the way from New Zealand this morning. The Deputy Commander of the Republic of Fiji Military Forces and the Commander of the Fiji Navy, Commodore Humphrey Tawake. I see the Chairman of the Administrators, Mr. Prem Singh, Chief Executive of the Sugarcane Growers Fund, Mr. Raj Sharma, and I also welcome my brother-in-law and sister, Umesh and Gyan, who just arrived from the US this morning. This morning I visited a number of communities affected by the flood, and I must say that I'm extremely pleased with the resilience and also the timely manner in which the NDMO, the Commissioner Western, and all the staff of the ministry responsible for natural disaster have acted. And I want to take this opportunity to thank all of them, including some of the NGOs, religious organizations which looked after our people. We hope and pray in this country that we don't get hit by a devastating cyclone or flood, and the impact of climate change obviously is all real for us to see. I'm absolutely delighted to be here today, especially on the last day of 2024, and to be part of this very important occasion, the official launch of the Hyperbaric Chamber and the Sugarcane Growers Fund loyalty program. I think today's event not only marks an exciting new chapter for the Pacific Specialist Healthcare, in many ways already a leader in private care in Fiji and the Pacific, but gives greater confidence and assurance to the broader medical community and most importantly our people. So this launch of the Hyperbaric Chamber and the Sugarcane Growers Fund loyalty program reflects the hospital's commitment to providing cutting-edge care, but also to the broader vision of improving access to modern health care by all Fijians. The hyperbaric oxygen therapy, HBOT for short, offered through this hyperbaric chamber, in my view and from what I heard, is a cutting-edge treatment that involves breathing pure oxygen in a pressurized environment and treats a wide range of conditions, including chronic wounds, burns, decompression, sickness, carbon monoxide poisoning, and diabetic foot ulcers. So in some ways, this is a groundbreaking treatment and which has the potential to significantly impact the recovery and well-being of patients, promoting faster healing and better recovery, which can ultimately improve the quality of life of many of our people. As you are aware, most of you, recently we commissioned a World Bank study on the status of our health in the country, and the report was launched by the Honorable Prime Minister a few weeks back. And what it shows is quite damaging. You know, what it shows that our health outcomes in the 1970s, 80s, and 90s were better than what we saw happen in the last 10 to 15 years. The scourge of NCDs, non-communicable diseases, is now the biggest cause of death in Fiji. The shocking rate of amputation is well known not only here in Fiji, but throughout the world. And so I think this innovation, this new service has potential to not only address some of the fundamental ills, medical ills that we have, but also help publicize the economic cost and the burden on families and indeed for the whole country. In fact, what we have seen, and the report of the World Bank is very clear, which shows that if we were investing heavily and appropriately in public health care, public health facilities, public health promotion, the cost of our services would be much lower. And as Pravesh said very clearly, it shows that the out-of-pocket expenses for Fijians is much lower compared to what you find in many other countries, including in the US as well. So as far as the government is concerned, the WHO standard health expenditure is about 4.5% of GDP. Since we've come into government, in the last two budgets, we have raised the bar in terms of our expenditure, which is now 4% of GDP, 0.5 short of the international standard of what is allocated to healthcare in many of the countries. And I was very carefully listening to Pravesh. I think he provided a very good detail of what the services are, so I don't want to go into details of that. But it's quite exciting, the model that you want to build, particularly collaborating with the Pacific Island countries, and indeed Fiji is the hub of the Pacific. Any infrastructure, particularly health, education, ports, airports, we build in this country, we can quite safely call those Pacific infrastructure because we work very closely with our Pacific Island neighbors. So the priority of the coalition government, and the Honorable Prime Minister has said this very clearly when he launched the World Bank review on health in the country, is that we want to make sure that we provide the best medical care to our people, but also to build the state-of-the-art facilities in the future to ensure that we become international center for specialist medical treatment as well, which will help not only the country generally in the Pacific, but also our tourism industry. We are working very closely with the Australian government to develop a comprehensive infrastructure master plan for the CWM hospital, and beyond that, another new national hospital, which will be Fiji's largest medical facility in the near future. The construction of the Indian government 100-bed super specialty hospital will begin soon, and is expected to be completed by the end of 2026. And the government is very clear. We are sorting out the Lautoka and Ba Hospital, the model there. And as I said in Parliament during the budget, fundamentally, government is paying significant amounts to ensure that those two hospitals provide the services that our people need. And so the health sector is fundamental to the overall development of any nation, and Fiji is no different. And having this partnership between government and the private sector, because we recognize that government alone would not be able to do everything, particularly specialist treatment. And so the opening of this hyperbaric chamber aligns with the coalition government's commitment to creating an environment where the healthcare system can thrive and thrive as well. The services that it provides to our people. We also believe that this partnership will help us to build better infrastructure, which is already a very good example of what you have done. So HBOT is a collaboration between the Fiji Navy and PSH hospitals. And I want to thank the Deputy Commander and the Commander of the Navy for partnering and collaborating with PSH and making sure that this technology this advanced technology is available for our people. And as we continue to make strides in advancing healthcare in our country, I want to encourage all stakeholders, both public and private, to collaborate, share expertise in order to further strengthen our medical services. And in that respect, the signing of the loyalty card agreement between the Sugarcane Growers Fund and Pacific Specialist Healthcare, in my view, is a significant milestone for both organizations and the sugarcane farming community. The government wholeheartedly welcomes this collaboration and is aligned with the health sector's goal outlined in the new National Development Plan, which emphasizes improving access to quality, safe and patient-focused clinical services through enhanced partnerships with local NGOs, community groups, and to extend healthcare outreach and education to rural areas. Let me also say that as part of the National Development Plan, 3-year, 5-year and 20-year, our vision in the 3-year plan is to ensure that we get back to the basics, which means, we make sure that we provide basic health services, education services, roads, water supply, electricity, and rural development in general. And so this fits into the government's long-term vision and the short and medium-term vision as a country. The loyalty program, the SCGF loyalty program launched earlier this month, offers a unique initiative in which SCGF has partnered with suppliers and service providers to provide discounts of 5 to 20% of all active cane growers. And I want to commend the board and the CEO for this innovative program. And I also want to acknowledge PSH for their contribution in offering discounts such as the reduced general consultation fee of $7.50 and a 10% discount on other fees. I know the chairman wants more. SCGF has introduced various programs and incentives such as the loyalty program, the recent termite home loan package with a 2.99% interest rate, and the green cane incentive, where growers who harvest over 75% of green cane benefit from a reduced interest rate of 4%. I also recall launching the My SCGF app in 2023, which is also helpful. Additionally, from January 1st, as the chairman announced, I'm very pleased to know that you're reducing the interest rates from 6% to 4.5%. I think that aligns with the government's own monetary policy, where we have kept the interest rate generally low compared to what you see happen in Australia and New Zealand, and I think that has also helped. This will quite effectively ease the burden on farmers with an estimated savings of around $500,000. The government continues to support the sugar industry through subsidies and grants, and last season growers received $105.08 per ton, the highest cane price ever in the history of this country. So I think this is a great partnership between the Fiji Navy, the Growers Fund, and the PSH. And therefore, I would like to commend PSH, Pravish, you in particular, as founder and CEO, for your leadership in healthcare innovation. I think it reflects your own ongoing commitment to excellence and patient-centered care. And I'm confident that this hyperbaric chamber will make a meaningful difference in the lives of many patients, bringing hope and healing to those in need. And together we can create a robust healthcare system that meets the needs of our diverse population and helps build a healthier, more prosperous future for all. I am very pleased, therefore, to officially declare the hyperbaric oxygen therapy services at PSH Hospital is open. And I'd like to wish your team success in their mission, or in your mission, to provide advanced and compassionate care and be the beacon of hope for all Fijians and Pacific Island people. I also want to take this opportunity to wish all of you a very happy new year. Please look after yourselves tonight. Look after your family and children. I also want to take this opportunity again to thank all our people within the National Disaster Management Office, the police, all civil servants, and all those who've been involved in helping our people during these very adverse weather conditions, which has led to flooding in some areas. I was in Singatoka. I met quite a few people there, representatives from the Valley Road, Kamananga Sau, Villa Levu, Nambitu. There's been some damage done to crops, but we still feel that we are lucky. I can see very good weather outside, and I hope that it remains the same. So once again, Pravish, congratulations, and thank you all for coming over today. Vinaka Vakalevu and Dhanyawad.